Hey everyone, Dr. J here. Welcome to my show, The Real Story. This is the real story on women's health. I am Dr. Denise Jagru, your women's health specialist. Today we're going to do a webisode on MythBusters for pregnant women. Every week I change up my format a little bit. Sometimes I do webisodes about Q&As or interviews or demonstrations of different exercises, sometimes recipes that are good for anti-inflammation, for pelvic pain. Do a lot of different things. So today we're talking about myths that can be true or false, and hopefully this will clear things up for you a little bit. Myth number one, sit-ups are bad. Yes, true. Sit-ups are bad. Sit-ups are definitely not something you want to be doing when you are pregnant. You have a lot of hormones coursing through your body. One in particular called relaxin. Relaxin literally relaxes, and it focuses on the connective tissues in your body. You have one main connective tissue in between your six-pack muscles down the midline of your abdomen. That's called your linea alba. So when that tissue becomes a little weaker, a little more relaxed because of this hormone, your abdominal muscles tend to separate. So maybe you noticed when you went from laying down to sitting up, your abdomen kind of bulges to a point or like a midline ridge. That may be indicative of a condition called diastasis recti, which is the separating of your abdominal muscles. So you do not want to make this worse. If you think you have this, please seek out the help of a women's health physical therapist, a pelvic physical therapist, and they can help you with this. It's very specific exercises you should be doing, movements you should be avoiding, and a special brace that you should be wearing. So going from laying down to sitting up makes it worse. If you do crunches and sit-ups, it makes it worse. So don't do them. Do not do crunches. Sit-ups are bad. There are other ways to strengthen your abdominal muscles, and you can learn these other ways from a trained professional. Trained professional, meaning a physical therapist. Okay, so that's myth one. Sit-ups, bad. Myth number two, you should not be exercising when you're pregnant. False. That's not true. There was an old theory that went around saying that you shouldn't get your heart rate above 140 beats per minute if you were pregnant. That is an old, that's an old theory, and that's been thrown out by the American College of Gynecologists and Obstetricians. The main test you should use is the talk test. If you can maintain a conversation with somebody while you were pregnant, while you were exercising, you're good. Don't worry about your heart rate. You should be exercising. This is good for the baby. This is good for you. And you are doing too much if you cannot maintain like a full conversation and get out a full sentence without gasping for air. You may be overheating, and you may be overdoing it. So just make sure that you take it down a notch, okay? Be able to say a full sentence without gasping for air, okay? Myth number three, it's normal to pee yourself when you're pregnant, when you cough, laugh, or sneeze. Now, this is tricky. There is a baby, a 9-month tenant that you have, a rather large one, who is pushing on your bladder. So yes, it is common to have pressure on your bladder and have weak pelvic floor muscles. And yes, you may pee when you cough, laugh, or sneeze, or if you just can't get to the bathroom on time. And that's okay for now, but it doesn't mean that you can't strengthen your pelvic floor muscles, which means seeing a pelvic physical therapist or a women's health physical therapist who can help you. No one ever does Kegels properly on their own. Make sure that you seek out the help of a trained professional to help you find the muscles. The muscles are on the inside. There are a lot of different awareness techniques and strengthening techniques that can help you try and stay dry during your pregnancy. It's going to get a little harder to do that at the end of the pregnancy, but definitely engage in those exercises. Keep those muscles strong. It'll help you with labor and delivery, and it'll help you with recovery as well. Myth number four, the baby can feel when you have sex during pregnancy. Baby's fine. Baby don't know anything. Baby is very protected. You're not gonna hurt the baby. Baby doesn't care what you're doing. Baby's getting fed, baby's warm. Baby's all good. There are some theories about whether intercourse can help you go into labor quickly, and that has to do with a chemical component in the male ejaculatory fluid and how it affects the cervix and how it affects contractions. So that has some validity to it, but the baby's fine. Baby's pretty protected. You're okay. You can go for it. You just have to work on different positions that feel the most comfortable for you, the ones that are safest for you, and you can just work that out with your partner. Okay. Myth number 5, prenatal classes and celebrity trainers are great and they know what they're talking about. Okay, so this one's a little tricky. I don't want to knock any personal trainers or prenatal classes, but you have to be careful. Please find out if you're seeing someone for prenatal personal training, please make sure that they have obstetric training and they know all the precautions of things that you should be doing. Make sure they're checking your blood pressure all the time for any hypertensive conditions. This is so important. It's all about looking out for red flags, knowing what your body is doing every month, how your body is changing, and how to modify that. When I see pregnant women in my office, it's always a challenge because every week is different. Your body is different every week. Your body is changing, your weight is changing, meaning your center of gravity is changing, so that changes your mechanics. So that's very important that the person you're working with understands that and understands what they should be looking for in terms of red flags. I've had a lot of women come to my office having hurt themselves from prenatal classes, prenatal yoga classes. You want to avoid things like doing exercise on your hands and knees. You want to avoid exercises where you're going into too much extension. I've seen a lot of injuries from this. So please be careful. I know that there are some great prenatal classes and great personal trainers who work with pregnant women, but do your research, make sure they know what they're talking about, talk to other people who have gone to them and see how they've recovered afterwards and if they've had any trouble. So, like I said, I'm not trying to knock anybody. I just want to say be informed and be careful. Sometimes, I've seen celebrity trainers give terrible advice, which if my patients or anyone I know followed this advice, they would have gotten really injured. So be careful. And again, I'm biased. Always go to a women's health physical therapist or a pelvic physical therapist who can help you make the right decisions. All right, I hope I cleared some myths up for you. And if you have any questions, just shoot me a message. Check out my website, drjagru.com. I am a women's health specialist. I have an office in Midtown Manhattan. I also make house calls. If you're too pregnant to come out, I can always come to you. So check out my other videos. Tune in next week for more women's health info. Thanks. Bye.